So we've learned a lot throughout this morning and have learned a lot myself. So what has hiring and best practices in hiring got to do with health? I think throughout our sessions we've learned that, and we've clearly established the fact that indeed your status in life affect your health, and likewise your health affects your status in life. So what we're going to be doing, I'm going to be talking about a couple of things. Just to clarify, Dr. Carson was my former prof, so it's a good combination. So I'm going to talk about really what is the business case for having a diverse workforce. Also, I'll talk about the history of employment equity and how it relates to Nova Scotia, and specifically the Public Service Commission. What is the business case for having a diverse workforce, apart from it being a morally good thing to do? What is the business case? Why do we have to do that? And I have a quote here from Dr. Linda, sorry. I have too much stuff with me, so just gonna. Dr. Linda Duxbury, and she said, any government public sector, regardless whether it's a municipal government, provincial, or federal, will be facing some big issues in the coming years. And why so? Like Dr. Mackenzie said, Nova Scotia have an aging population. And we know that the replacement rate for every population is 2.1. In Nova Scotia in 1976, it was 1.85. In 2001, it declined to 1.35. In 2005, it's increased slightly, but still 1.4. So we are not having enough babies to maintain our population. So we don't really have the choice in terms of picky and being choosy about who we actually need in our skills workforce. And we need a paradigm shift where we begin to think more than what we are doing now and begin to look into the future if we are supposed to sustain our population and, of course, grow our economy. The second point I said, population is declining, we have an aging population, but if you look at the census that has gone on over the past decade, not all the population is declining. If you look at certain specific communities, like the Aboriginal community, the African Nova Scotia community, the data is very different from that point. We know that from the 2001 census, population growth for the Aboriginal community grew by 37%. Okay, and then persons with disability, we currently have about 12.4% of the population in Nova Scotia having self-identifying as having a disability. For the African Nova Scotian community, between 1996 to 2002, the population grew by 8.6%. So even though we are saying we have an aging population and we are not having enough babies, in specific communities, it's not the case. So what we need to do is to capitalize on the human resources we have now and use them to their best abilities. And in production management, we talk about you can outsource or you can make. Immigration is good, and I think we need immigration, but it won't solve our problem in the long term. We will still have issues even if we increase immigration by 10% or by 50%. What we need to be doing now is to capitalize on the actual human resources we currently have available to us, and that is with these specific communities, and not get picky with immigrant and credential assessment, women returning back to the workforce as we saw through the interview process, and begin to use those resources we have effectively. The other point I would like to say is that we know that when you have diversity around the table, it improves decision-making. And of course, we need to be culturally competent. If I asked what is the most spoken language, if you look at the population of Nova Scotia in terms of those who speak more than one language, what is the most spoken language? If I could ask. Arabic, right? It's not French. I would have thought it's French. It's Arabic. The face of Nova Scotia is changing, which means we as public servants need to be culturally competent to serve these diverse needs. And we can only do that when we begin to employ them within the workforce. And I'll give an example of my own situation. I went to IWK, and you know what women do when we go to the Grace maternity. And a young lady walked in, and she was a black doctor, and she introduced herself. And when she mentioned her name, I realized she was Ghanaian, but she was a first-generation Ghanaian immigrant. So we began to talk about Ghana and all that stuff, and it's just the ease that was in the room for a woman that is in labor, and having someone who potentially could speak your language, and that discussion, that is very good. And it would be really nice that we have more nurses who can speak Arabic, more nurses who can speak other dialects like Swahili, and of course we have a huge Akkadian community, French as well. So that is culturally competent. You're not just telling people, teaching people. We can teach people, educate people about the various communities we have, but having them within our midst itself is a good asset to have, and it enhances the way we make regulations, policies, and program. And if we talk about the public service values and the public good, that is where we want to be. But how do we do that when we are not culturally competent? So it's not just a good thing to do, it's the smart thing to do when we talk about diverse workforce. So what I'm going to do now is basically go through the framework for hiring for the provincial government, and that is for the Public Service Commission. We are guided by our public service values, which is respect, integrity, diversity, accountability, and the public good. So all that we do in terms of hiring, these values are embedded within. And we have legislations like the Human Rights Act, the Civil Service Act, the Charter of Rights and Freedom, and that is the foundation to developing any policies. We have guidelines and policies like the Employment Equity Policy, the Fair Hiring Policy, the Respectful Workplace Policies. Those are the foundational policies upon which we develop our processes and guidelines. And of course, we have accountabilities. There is no need having all those programs if no one is held accountable. So from the Public Service Commissioner to deputy heads to the line managers, everyone is held accountable throughout the hiring process. So I'm going to briefly go through this in terms of the history of employment equity and what the provincial government has done throughout the decades. In the 50s and 60s, we heard the word equal opportunity employer, and that was used a lot. We heard about pay equity, equal pay for equal work. In the 70s, we had pressures from employment equity groups and women, of course. And then 1976, the Human Rights Act was enacted. In 1978, the provincial government actually released a statement outlining its standing or position in terms of equality of employment for minority groups. But that did not really deal with our problem, and we're still dealing with it. And in 1984, we all know of the Abela report that actually identified the 4 minority groups that still faced numerous or gross inequalities when it comes to employment, being Aboriginal people, African Nova Scotians, racially, African Nova Scotians were not part of the federal the employment equity groups that were identified in our Abela report. We, the provincial government, distinguished African Nova Scotians as a unique group, just like the Aboriginal, based on the history and the fact that they've been here for quite a bit now. So the employment equity groups outlined by the Abela report were Aboriginal people, persons with disability, women in occupations we consider underrepresented, and of course, racially visible minorities. And then for the provincial government, it was 1992 that we had our first race and relation training for the public servants. And then in 1993, we have the self-identification survey, which is voluntary and is still voluntary. In 2001, we had the affirmative action policy. And then in 2005, in 1995, we had the policy, and in 2001, we updated that policy. In 2005, government created what we call the HR corporate plan, and one of the goals were to be a diverse workforce. And then in 2008, the affirmative action policy was reviewed, and the name affirmative action was changed from AA, affirmative action, to employment equity. And as I was going through the history, you can see that from the 60s, 70s to the 80s, we're talking about equality, equality, equality. Equality is not the same as equity. Equality is treating everybody the same, but we know that when we treat everybody the same, we can be very, we cannot be just sometimes. So we're moving from equality, where we treat everybody the same, to equity, which is justice, trying to make sure that everybody is treated fairly. For example, if I'm interviewing people and someone self-identifies as having hearing impairment, employment equity goes beyond giving everybody the same question to actually getting an interpreter to be in the room to interpret the questions for that person, or brailing the questions for someone who is visually impaired, or making accommodations in terms of what you use in your final selection criteria. That is employment equity. Employment equity is not hiring unqualified people. It's providing a level playing field for everybody to compete fairly. Just to stress that point. So what does our employment equity policy state? The employment equity policy for provincial government, it states the government of Nova Scotia is committed to being a workforce that is free of discrimination, values diversity, and is representative at all job levels of the designated groups, that is Aboriginal people, African Nova Scotians, and other racially visible persons, persons with disability, and women in occupations we consider underrepresented. And I must clarify that we do know that there are people who don't clearly fit within these four groups, but do face huge disparities and inequalities, like we talk about women coming back to the workforce after staying home for a while. So why an employment equity policy? Basically, we want to be more inclusive and to be more culturally competent. We want to continue to eliminate barriers or systemic barriers within the system that actually can be very discriminatory for minority groups. And of course, we want to achieve equity, and we're still not there yet. When you look at the four groups that I've identified when it comes to employment equity, they form about 17.53% of the general workforce. However, with the provincial government, they account for only 7.1%. That is actually less than half. So we're getting there, we're not there yet. There's gross underrepresentation of these groups within the provincial government. I'm just going to talk a little bit about some of the directives of the policy. So what we've done in terms of specific directives from job postings, we want to clearly state that we welcome people of the minority groups, and that is on all our job postings. And accommodation, as I said, we need to begin to be accommodative of differences, and even throughout the interviewing process, make sure people have a level playing field and they feel comfortable. In terms of selection panels, we have developed a selection panel database where we have people who fall within the minority groups who are well trained in terms of interviewing, and we can rely on them to sit on our panels to ensure objectivity during the interviewing process. And of course, within our selection, even within the collective agreement, just to clarify, we are a unionized employer, and therefore we have to abide by our collective agreement. But within that, to be creative in a way where we can allow for some room to appoint employment equity candidates, even over other candidates, if it is in the best interest of the organization. We have self-identification surveys, which is given to every employee that is employed, so you get to self-identify. That is the only way we can have a good profile of how we look like and to be able to be accountable. We continue to make improvement in terms of identification of and removal of barriers. We have employment equity plans, and what that actually does is every department is mandated to provide a plan of how do you hope to achieve equity at some point. So it's not about quotas. Departments write their own plans in terms of they identify that we are underrepresented. These are the things we hope to do in the next year or two to ensure that we close that gap. And of course, they provide employment equity progress reports to our Public Service Commissioner on a yearly basis. We continue to communicate and educate people through our training and to make sure that we are all up to speed of what is happening in our world. Some of the programs we have in place currently, some of you may know about a diversity talent pool. This is actually an employment equity inventory. So what we do is We're going to be currently posting a couple of casual rosters. We post casual rosters. We ask members of the 4 groups to apply. We select, we test them, we interview them, we check references, and we keep their resumes in our database. And we are able to refer those resumes of these qualified applicants to hiring managers so they can hire them for casual positions. We have an accommodation fund, and what that actually does is to provide assistance to hiring managers when they hire somebody and they need to buy equipment. For example, if somebody has a back problem and need a special ergonomic chair, that fund can be tapped into by the hiring manager to make the hiring process much easier. We have a couple of career starts program, which is a very successful program for the provincial government. We have a 2-year internship, and then we have the summer diversity, summer female mentorship that target employment equity groups again in providing them summer jobs during the summer, and hopefully they can come back and work for government. And of course, we have our main co-op streams. And throughout all these programs, we ensure that the employment equity policy and the fair hiring policy is used so we can hire more minorities. We have other programs, we have other policies like the respectful workplace policy, the employment recognition policy, which is available for people when they face harassment and bullying in the workplace. And there is, a process there you can follow. We have the employee assistance program to help people through issues. And what I really wanted to talk about is some best practices in terms of hiring. So advertising. In terms of advertising, you really want to, as a hiring manager, base your qualifications on the job description. If the person is going to do A, B, C, that is what you advertise for. No other imaginary criteria in your mind. I don't know how I can say that. That is what you advertise for. If you advertise for 3 years with a bachelor's degree, that is what you select on. That's what you advertise for. And we really want to be proactive in reaching out to communities like the African Nova Scotian Employment Networks, the Persons with Disability Networks, the Aboriginal community. They have FirstNet. How many of you know about FirstNet? Okay, nobody. FirstNet is an internet site which is very big for the Aboriginal community in Nova Scotia. And as an employer, we are registered on the website. So if I have jobs for our co-ops or any of those jobs, we encourage our hiring managers to actually physically post those jobs there, just to make sure that people have access to these jobs so they can apply. There is no need Career Beacon is the standard, fine, but we want to reach out. There is ISIS, and I can see Moja there. ISIS is a good place to advertise your jobs. They are qualified immigrants. If you have issues about credential assessment, they can help you through the process. We have the job search centers in Dartmouth and all, Job Juncture. Those are areas we can reach out to because most of Lake City Employment, I have actually, I've been working with them on a couple of things. These are employment groups where we can actually reach out to and make our jobs that are available accessible to these individuals, because they go there when they're looking for jobs, right? Not everybody has access to internet to go on Career Beacon sometimes. We want to use our diversity statement. We want to be very clear and mean it that you welcome people from minority groups. That should be on your job. And then we want to use generic terms. Not everybody is familiar with the terms we use, and especially if it's unique to your organization. For example, instead of saying Outlook or group-wise, why don't you say email applications? Instead of saying WordPerfect, that is Coral, right? Or Word, why don't you say word processing, spreadsheet, instead of saying Excel or Quattro Pro? How many people know about Quattro Pro if you're not in government, right? And that is all, people see these things and the first impression is, oh, I don't qualify. So they don't even apply for. So we want to be very careful the way we advertise our jobs. Our selection process, you want to be very open-minded when you receive your resumes. You want to consider equivalences like PLA, Prior Learning Assessment and Recognition, and of course, credential assessment as well. If, like Toyin said this morning, if somebody applies for a job and have a CA from Nigeria, You can talk to ISIS and say, what does a CN in Nigeria, what is the equivalence for the Canadian setting? You don't necessarily put the resume away just by seeing that, or if somebody's from China and has an engineering degree, you can actually advise that person to have the correct recognition given to them, than instead of just putting the resume somewhere. And of course, your criteria for selection should be always directly related to what you posted for on the website. You don't want to post something and screen on something else. And the big one is interviews. Sorry, I removed that. So interview and panel selection. Interview is a big one, and I wanted to tell Sandy Goodwin, when I had my first interview, Public Service Commission, my boss was visually impaired too, just like you, Charlie McDonald, whom some of you know of, and that I saw his guide dog lying behind there. I just said hi to him and proceeded with my interview. So interview is a big one for most people, and I've had the privilege of working with a lot of minority people, and the big one, they're always nervous. Right? What to expect? What is the person going to think about me when I walk into the room? So we really want to watch that and try and eliminate some of the biases if we can, as much as possible. We recommend that ideally you have 3 people. That is an objective number. You want to have an HR person in the room. And if someone self-identify, you want to go to the extent to make sure there's representation in that room. If the person has self-identified, you can call the Public Service Commission. We have a list of qualified people who can sit on interview panels who belong to the minority groups. It is nice to enter a room, being a black woman, and see another black woman there. It just set that pace of ease for the person to contribute her best during the interview process. It is nice if I'm in a wheelchair and I go in the room and there's somebody who's in a wheelchair there too. It is best practice. It is not always that you can get that representation, but you want to aim at getting to that point. Types of questions asked. You really want to avoid questions that are discriminatory. And I'll read a couple of them. Are you a U.S. citizen? Do you come from Asia? Do you have visual or speech impairment? Are you planning to have a family? Have you ever filed for workers' compensation before? How many days of work did you miss last year due to illness? What off-job activities do you like to participate in? Would you have a problem having a female partner? Where did you grow up? Do you have children? How old are they? What did you... I'm just laughing as I go through. But the reality, these things happen. And according to Human Rights Act, it's illegal to ask questions about people's nationality, their mother tongue, citizenship, where they went to school, and all that stuff. You could ask, in terms of verifying people's credential, that during the interview process, they actually bring their diplomas or their certificate. That is okay. But you don't ask about where did you go to primary school or elementary school. I'm using primary school, don't worry, because I come from the old British. I went to a primary school, not elementary school. But elementary school, right? Why are you asking that question? That is the intent. It's against Human Rights Act to ask these questions. And to be very specific, let me just read this so I don't miss them. Sorry. Under Human Rights Act, you cannot ask questions that relate or about a job, and you want to avoid asking questions about disability, physical or mental, race or color, sex, sexual orientation, marital status, ethnic origin, religion or creed, source of income, political belief, affiliation, and age. Those are discriminatory, and you don't want to go there. And so, biases, that is a big one too. We have to know them. To pretend they are not there doesn't solve the problem. They are there, and once we know them and acknowledge that they exist, then we can actually do something about them. So I'm going to talk a little bit about some of the biases. The most common one is stereotyping. A person walks into the room, he's self-identified and think maybe an Aboriginal, or by virtue of the looks, This is an Arab. Is he going to be a terrorist? You're thinking about all that in your mind, right? That is stereotyping. He's an Aboriginal. He's this or that. If you begin to make assumption based on certain ideas you have behind your mind, you actually begin to rate that person indirectly with those behind your mind without knowing. It's very subtle, but it does happen through a lot of interviewing process. You have the halo effect. You meet the person, you talk to the person, you have this very positive feeling about who the person is, and then every other thing the person says is perfect. You don't even go beyond to actually make sure what they are saying is right or wrong. The opposite is the devil's horn. You see the person may have said something, or by virtue of what they are wearing, you imagine certain things, he's this or that, and that reads, or it goes into how you interpret the person's answers and how you actually evaluate them. And especially for the public service, when we actually do rating and write numbers, a 7 could be different from an 8, right? It's very subjective there. And because those biases behind your mind and how you think is affecting how you're rating that individual. Okay, first impression, I've talked about that. And that's what we call contrast effect. Someone comes to the room and you love that person. This is the perfect person. We get along well. She talks like I talk. We can really work along well. So you make the person the standard and you begin to evaluate every other person against that person. That happens a lot. And so you're not being objective through the process. So some of the common biases we see during our interview process. So I like to use the word please. We want to be very, very patient. We want to listen. We want to emphasize. We want to take away stereotyping. And we want to put in a little effort into planning our interviewing process. If it means waiting 2 more days to get a representation on your panel, I think it's worth it. Hiring cost, it's a big cost. And if you do it wrong, it even costs the more because you have to go back and redo all that. And as I've said, we don't have too many choices about being picky about who we hire. There is a strong business case of having a diverse workforce. And it's good for us. It's make us more culturally competent. And it's help us to serve Nova Scotians better. Thank you very much.
So the first part of our remarks I've written because I tend to go on a little bit about some of this stuff, and then I have more informal remarks the farther I get into my comments. But I think about the first part of what I'm going to say is on the subject of working for equality in employment and how we conduct organizations. So equity, diversity, affirmative action, and other forms of programs on are all programs on equality which seek to theorize and produce policies and practices. They are the ways we have been using to address inequality in access, advancement, recognition, entitlement, and employment. The Government of Canada mandated equity program has presented a lot of evidence which documents the numerical improvement in representativeness in the workforce and some important benefits to employers and businesses with respect to organizational capacity and improvement in the delivery of services to marginalized groups, as well as the benefits, the business benefits both domestically and in international markets. So now Lydia, you don't have to help me, I will do it. Okay. But I appreciate it very, very much. If we look at the kind of innovations that are attributed to equity and affirmative action programs, we can see that, one, they have been successful in at least making senior leadership aware and at times engaged in the issue of diversity and equality. It has fostered interorganizational cooperation in a variety of domains. It's encouraged information sharing of a variety of kinds, including the kind of work that you're doing here today. that it has also developed a lot of best practice work in labor management collaboration. And if I were to identify one area that I think is the most significant and can make the most improvement fastest, it's in this area of the cooperation between labor and management in relationship to workforce development and collective agreements. There have been the whole development of outreach to communities, and it promotes cultural learning in a variety of ways. Anne Devine, who's now at the Human Rights Commission in Nova Scotia, and I, a few years ago, did a research study on the federal contractors program in Nova Scotia. So this is the part of the federal equity program that is directed toward federally incorporated businesses. And one of the things that we were quite amused by was that almost every business that was mandated to have affirmative action under their contractual arrangements reported that they had what? Potlucks to encourage cultural diversity, and et cetera. And both of us agreed that food is important, and any way you promote this is more or less fine with us. But apart from whatever problems there are with the thinking, analysis, and conceptualization and underlying theories and policies, the fact is that overall the practice and implementation of these practices do not work to create an inclusive and integrated labor force. The fact is that we have my friend Carol Geller was the person who actually developed the employment equity program in the 1970s for the Government of Canada. And while I don't want to in any kind of way criticize or undermine the work, in fact, I want to congratulate you on being here and on the work that you're initiating. The fact of the matter is that none of these programs have worked to routinely include and integrate persons of difference in the workforce. And that has to be our goal. We shouldn't need specialized practices or programs in order to have us all have access to employment, have us all make our contributions to the workforce and to our organizations, and for us all to have influence in the organizations in which we work. So it's my view that the principal reason for the very, very modest success and the very great cost of that success in our own efforts to date is because we have largely been working in the wrong place and with the wrong groups of people. Most equality-seeking practices in the workplace focus on the deficiencies of the group or groups being brought into the workforce. These deficiencies are always numerous from the point of view of employers and existing employees. However, overall, individuals have overcome these formal deficiencies before they are hired. The major barriers to workforce inclusion and integration of whatever group you would like to identify are the limitations, work, organizational culture, and normative order of the existing workforce and management, and the management and work systems they use to create the routine basis for their organization. So what I'm saying is that that it's both the systems we use to organize the workforce and to evaluate it, and it's the people who routinely get to operate that really is at issue. And while I laud the sorts of things that Lydia has just said, and they're absolutely wonderful, the fact is that most hiring gets done by people who couldn't care less about any of these issues. I'm sorry to be the bearer of bad news. It's It's making me more anxious as I go on. I think, oh, God. So I'm very, very impressed with the emphasis in this conference in which you are focusing on the skills, knowledge, comfort with pluralism and differences, be it culture, race, beliefs, sexuality, size, language, accent, and so on. This is an important step. It opens us to an examination of our deficits in relationship to recognizing and accepting difference. And it directs our attention to acquiring a vast array of new ways of seeing, skills, and attitudes. This does not in any way diminish our current capacities. It augments and broadens our perspectives. In employment, it means that attracting, recruiting, interviewing, hiring, orienting, working with, working for, and managing people with what you are now calling cultural competence. The notion of cultural competence shifts the attention away from other or stranger to us, ourselves, and our ways of doing things and the systems of organization we use to do those things with. So the question I just want to sort of show, so I think it's always important to say, like, where are we going? So this is my idea of what we have when we have equality at work. First of all, when we have equality at work, we do not call one another troublemakers when we disagree with each other. We have equality of work when people can access the workforce on the basis of their abilities and the skills and their character, and not on the basis of who they know or what they bring by way of difference. So the first issue that we have to deal with is access. And you can see that many of our programs address this business of access. How are we going to, and there's great hand-wringing in the country, including in this province. I don't understand why we don't have more of those people applying. We'd certainly hire them if we could find them. Now, I have to tell you that at the School of Public Administration, we have a very, very diverse national and international class every year. And we have an internship program between the first and second years where one of us, currently me, we as professors has to run this internship program and get employers to give us work terms of high quality for our students. And this means also then that we often have grads or we have people wandering into our classes. In my case, it's normally my equality class, who come and you think, oh my God, these people are so good. So I want to give you two quick examples of this, and if I sound bitter, I am. So the first one is a young woman who is a citizen, but is a naturalized citizen. She's from Kenya. She has 3 Canadian degrees, including ours. And on it, she had an excellent, outstanding internship in a government that I won't name at the moment. And I have to tell you, I banged down every door and, put the fingertips have calluses on them from banging on the numbers on the phone, trying to get someone to pay attention to her and hire her. Well, naturally, she's gone where? To Ottawa, right? Where she, by the way, is going to do fabulously. This is a woman who, anyway, I won't go on. Secondly, a few years ago, a young guy came into my equality class, and he's doing a degree in one of the business degrees in our faculty, but he's from Nigeria. He went to a very fancy private school for his elementary and secondary education, and he has a very, very, very upper first from the London School of Economics. And he's getting the second degree in the business school. And as part of his program, he really needed a work term. And the business school being what it is, you have to sort of competitively search out your work term. And the problem with that, of course, is that if you don't have the social capital in a community like this, you can't get one. So again, I made myself unpopular to an extremely large number of people. Like, I'm just cut off so many people's lists, they won't answer the phone to me, trying to get this guy an internship. Well, you know, I eventually did, but in Manitoba. Right? Like, we're crazy people in this province. We really, really are. So what I want to just say is that we need routine forms of access that don't make us feel like we're some kind of like total giants if we manage to get over all the hurdles and get ourselves, if we're different, get ourselves into the public service or to get into jobs generally. That's the first page gone. You can sort of be glad about that. Then the next thing is that we need recognition at work. We need to be able to see the contributions that people make, irrespective of what package it comes in. Right? So, you know, one of the things, I've done so much research on this, it just makes me... Anyway, one of the things that employees of difference tell you is that they don't feel that they're heard. They don't feel that their contributions get the same recognition as other people. Now, you could assume that, you know, maybe 2 or 3 of these are sort of insecure louts who really should see a therapist. But overall, when you see this in very, very, very broad forms of research, you can see that this is not a feature of those people. It's a feature of the culture of those organizations. So it's a systemic problem. It's not an individual problem. The next thing is that people of difference need to have the same entitlement as everybody else to bitch and complain about the organizations they're in, to make criticisms, to offer suggestions for improvement, constructive or not. We certainly know in the workplace that we have lots of people who are, in quotes, normal, who are inveterate troublemakers. And finally, we have to be able to count that as individuals, with the contributions that we make and the recognition that we have, that we can compete for advancement, and that we have the similar equivalent forms of support, recognition, mentoring, and et cetera, that other people have in their advancement processes. Because when I did my PhD back in the Stone Age, I did it on this topic. Like, I feel like I've been talking about this topic all my life, and of course I have. So the reality is that people overall do not get advancement doing their own job well. They get advancement doing things in addition to their job well. And if you don't learn this from people at work, and if you're not included in those ways, then you have no hope of gaining advancement in public or private sector organizations. Sort of cheerful. So equality at work is what we want. And we want equality also in delivering services. And this doesn't mean we want things to be the same, it's that we want things to be equivalent. That's what equality means. So I start my equality class, which is in the second year of the MPA, with the question, which always bedazzles people. Why do we want equality? We want equality so everyone can give and do their best and receive our best. And in my opinion, we don't have to make a business case for this or any other case. We're doing it because it's the right thing to do. And that's not a moral matter, right? It's about this issue that everyone can give and do their best, and everyone can receive the best from other people. So the next thing I want to sort of chat about, yes, here we go, is this business of cultural competence and what normal is. So the problem with normal is that normal is beneath observation. Now, those of you who are of difference in some way, particularly, well, it doesn't matter particularly what, actually have a very, very keen awareness of the normal, because often you have spent your lives trying to constitute the normal, with or without success. And so normal is beneath observation. It's just the way we do things, and we generally don't notice how we do things. And so there's a field of sociology about this, by the way. And it is really, it's called ethnomethodology, and I'm sorry to say that sociology overall seems to have gone into the scrap heap, and this field, ethnomethodology, seems to have gotten lost somewhere along the line. But when I studied it at UBC, with Ken Stoddard, he had us doing exercises around, standing in line and describing how that got done and what was living room behavior. And he taught us, what it meant to see that behavior is contexted to settings, right? And that we we can learn to observe how our social world is actually put together, and we can learn to observe that routinely and make it useful to ourselves. So I'm a big believer in the skills that are associated with that kind of field of study and the kind of field work and field practices that allow us to investigate everyday practices, and also to investigate organizational and managerial practices, particularly of the documentary kind, for the ways in which they construct the normal. And the problem is we don't have, apart from a few of my students in the room, we don't have that many people we have lots of people who have experience of trying to construct the normal, but we don't have a lot of people with the technical ability to really unpack this. And I think that's a very, very big skill deficit in management and in HR offices. So, the point here is that not only is cultural competence about being open to learning the ways of other folk, but it's principally about knowing ourselves and being able to see the ways in which we construct difference, normality, and etc. And in some senses, I realize I'm preaching to the choir in the room, but if you think about those people who only had 10 minutes to come and give greetings and etc., then that's your gang, because they can take the world for granted. The normalcy of the world is just normal to them, which I'll speak about in a minute, and it's that is actually required to challenge, to really make some systematic changes. So now I know this is going to come as a surprise to most of you in the room, but I have this little theory. I call it the revolving door of equity. And the good news is that human rights has become part of work. So actually, it turns out we have human rights at work. Surprise. Secondly, this means that the protections that are in the Human Rights Act are protections that people have at work. And that's a very important thing to understand. It's one of the things that the unions in this country have understood some time ago and have been very, very good at working for their members. So the thing that I want to point out, now I discovered this because Her Honor Nan Francis invited me when she was head of the Human Rights Commission to do several pieces of work for the commission. And in some casework I did for the commission, I discovered this phenomena, which it turns out is quite broad spread. The phenomena is that you can have a very, very good equity record and an extremely poor human rights record at work at the same time in organizations. And I want to briefly kind of show you why that is. Now again, if you already know this stuff, just wave and I'll move on. Okay, so if you see that the top of the little wheel here is entry, so people of difference gain entry to the organization, they're very happy about this. I remember the first time I discovered this, I was teaching a course at Mount St. Vincent when I was at Acadia, and in the summertime I taught at the Mount a course on work and organization because I really wanted to be able to teach in my own field in sociology. And in that class, a guy came and he was just beaming the first day of classes, and he told me that he'd just been hired at one of the public utilities that will show remain unnamed. That he was just thrilled because he actually really got a good job. Now, this is a guy from the Black Nova Scotian community. And I gave this assignment out in class, and the assignment was to tell about a job-related experience. So when I got his page, you know, he gave me a huge gift because this is what he taught me, showed me. He talked about how, you know, they found out about jobs sort of through gossip in the community, which is a lot of ways in which you find out about jobs. And so he went down to the utility and put his application in, and when he did that, he was told that it was unlikely that he would get a job because they weren't hiring and blah, 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 blah. And so a few weeks later, they phoned him and asked him to come in for an interview, and he was over the moon. And imagine his great pleasure when he got hired into this great job, unionized, good pay, good benefits. And it only took him about 10 days of being on the job till he discovered that he was replacing a black person who had left. And that the other employees saw him not as someone qualified for the job, but saw him as a person who got the job because he was black. So there's the entry issues. Then, you know, you get into the job, people think you're there because you're a woman. Honestly, one of my dearest friends, he invited me when I first came to Nova Scotia to do some work with IPAC. You might know the organization. So we did this really great thing for deputy ministers in the region. It was really, really great. And we were talking on the phone one day. It's a very good thing it was on the phone. And we were talking about how you got to where you are. And he said to me, I mean, it was an unguarded moment. He said, well, Margaret, you got to where you are because you're a woman. Well, of course, I think I got to where I am in spite of being a woman, right? And so it's important to sort of understand that there are multiple consciousness, you know, around these issues and events. So whether people think you're hired because you're a woman or whatever, you go about trying to gain acceptance at work, which means kind of learning the rules and regulations and trying to get along with people and not saying too much at coffee that's going to irritate people and so on and so forth. And gradually, you know, you feel that you have some sort of comfort. And then, you know, a series of bad things happen. And so at some point you get your courage up and you start to raise these bad things. These bad things can be nasty racist jokes. They can be being frozen out of things. They can be not getting any good files. You know, it's a variety of things, right? But you start to raise that. And you find that as you raise this with your boss and your superiors and so on, that they start to avoid you. And you know then you've hit the barrier as troublemaker. Then you might go on and make a more formal complaint or inquiry, say with your union and so on and so forth. At that point, you cross the line. And then there's a whole process of marginalization that goes on. And eventually, for many, many, many employees, they leave. Now, there's quite a well-reported phenomena, which is that there's a retention problem with the equity groups, right? And this problem is theorized that they have so many opportunities, they just move on us, right? Well, I just would like to point out to you that that may be true, but it is also the problem of the revolving door of equity. And what the revolving door of equity tells us, it tells us that we don't have habitable organizations. Oh, small point. One of the things is that, like the reason why I put this together as a wheel is that it's really important to understand that these relationships are very dynamic, right? So often one thing will affect another. So then this is a diagram similar to Lydia's, but we have equity and human rights at work. There's legislation, there are programs. We have and do increase diversity and can have quite good equity performance as measured by the program categories. People who do this, people who put into place these kinds of programs, employers who put in place these kinds of programs, they think that you should be grateful. And instead of having a very happy workforce, which is diverse and lots of people having potlucks, instead you have organizational troubles, because when you get diversity, you can predict that you're going to have organizational troubles. Why is that? It's because those organizational troubles are a pointer to the problems that exist in the organization in relationship to difference. Then it shows you the limitation in the skills and capacities of managers, of employees, and it shows you the character of normal. And in my experience, normal in organizations is an extremely narrow band of behavior. And so if you think about it theoretically, which I don't necessarily recommend, you're trying to broaden out the band of acceptable behavior in organizations so you can get more inclusivity. And so you get very poor human rights performance in these kinds of settings, and those are actually growing. And I've done really a lot of casework now for lawyers and human rights commissions and women being kicked out of their jobs and on and on. And generally, I feel that no one can teach me anything new about this, but every so often. But this is a problem that we really, really, really need to focus upon if we want to really start to produce harmonious, inclusive, integrated organizations. So, current equity practices, first of all, I did my equity in the first year of the program in the MPA. All the professors teach a first-year course. And so we had in human resources in the public sector, which is what I teach, we had the discussion of diversity last week, like this last Tuesday. And so I get them to teach the chapter to themselves because, frankly, I'm a little bored of teaching it myself. So they teach the chapter to each other, and what is the first thing that's raised? But there's a dichotomy between merit and equity. And I have to tell you, in the scale of the things that are untrue in this world, this is very high. You know, I haven't seen this, frankly, but it is absolutely pervasive that you can't be both meritorious and a member of an equity group at the same time. And this is not the problem of individuals. This is a systemic problem embedded in managerial practices and in systems and theories of management itself. The second thing, as I've just pointed out, current equity practices, when they're successful, lead to organizational troubles. When Anne Devine and I did this study of federal contractors, excuse me, we got all the informants, all the people in the companies who are responsible for equity, we got them all together at the end and sort of showed them what our findings were and asked them to comment on them and stuff. And so they got to raise a whole number of other issues. And the first one that they raised was the counting problem. And so they would say, well, we have more equity in our company than is appeared because people won't report. They won't self-identify, right? So that, of course, makes me ask, like, why would this be a surprise to you? And what is it about people that they should self-identify? And why don't we have different practices so people don't have to self-identify and we still hire them? So counting and the problems in counting are an artifact of a highly unfair and really ridiculous form of organization in order to get equity participants into organizations. The last thing I'll just say about that is that, you know, I can be philosophical about it, and I think anyone who's been first, like I'm old enough that I was the first woman in economics at my university, and blah, 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 blah. You know, when I was 17, I thought economics was sort of interesting. Didn't really try to be first. But, so I just wanted to sort of say I sympathize with this whole kind of thing of being first. But the thing that really, I think, is tremendously problematic about this is that we are bringing people of difference into organizations where they have to educate the workforce and make their way. Often and still without supports and recognition in the face of a huge amount of research. What I just want to go on and remind you of is that there is an incredible cost to inequality. So I'm getting the time thing, so my slides will be available. But the things about inequality is they're expensive. They're expensive for us all. But the thing that's most important is that the making of inequality is a set of practical activities, and that we don't have inequality without privilege. And privilege is made by identifying differences, selecting commonalities for special treatment, justifying those qualities. Tall men are better managers. Tall white men are better managers. You're getting that. We treat those privileges that are gotten through an ideology as normal, and then as they're used over and over again, there's an historical intensification. And there's equally personal dimensions of privilege, which is that people's self-worth and social identity, life conditions, and social recognition are defined by standards that are their own, essentially. And I'm not saying that people of privilege don't have mental health problems or blah, blah, blah. I'm just simply saying that they arise out of a very different set of conditions. And there are special and specific practices through which we create inequality, and they are exactly the same as the practices that create privilege, but they go in the other direction. I was sort of relieved to hear Jimmy talk about this as well, but I've done a huge amount of casework for individuals, and I've looked into a whole bunch of cases to try to get implementation of deciders' decisions in human rights. And the thing that has impressed me the most is that the people, by the time they're either in some kind of legal process or in some kind of human rights process, they're sick. Their hair's falling out, they can barely put a sentence together, and you think, oh God, maybe they are incompetent just the way the employer is saying, right? But of course, the claim to incompetence comes at the end of a process of undermining and of making completely negative experiences for people. So the point is that the psychic energy, the spiritual energy, the psychological work of coming and being normal and being energetic and putting yourself out there when you're of difference is a huge daily work. Huge, right? And it goes completely unrecognized in relationship to how these processes work. So the cost of inequality is it makes some of us arrogant and patronizing, and some of us bitter and sick. And I'm finishing now, but on the bitter and sick moment, right? But I'm going to just tell just a very quick anecdote I worked on a case that involved race in corrections, and I was interviewing one of the complainants, who was a man who had been a corrections officer for 23 years, a black man. And when I interviewed him, he was off work, and so I went to his home to talk to him. And it was just wonderful to go into his house, because the pictures of all his children and his family and his nephews and the nieces, and walls of awards by community organizations for his volunteer work, and just, a life, a very, very highly contributory life. And he, of course, sat in a wheelchair with oxygen. And, it was clear to me in a flash. Racism makes you sick. It does. And I want to tell you that as soon as we can, I wish you'd hurry up to point out that sexism makes you sick, because then I'm going on permanent long-term disability. So I have a few other things, but they're in the slides, and I just want to just finish with just a couple of very quick points. One is that we need people to learn a different skill set. And that skill set begins with what's in a name. I can learn to say Mpamalanga. Every white person can, actually, it turns out. And we can learn to spell it. Right? So when I raised this at my class, this is the first year HR class on Monday, and said, what's in a name? One of the people in the class put a pop, and she said, she works in intake at one of the hospitals, I think. And she says, the girls always give me the people with the hard names and stuff to check in. Well, of course, I just about did my nut in class, right? Because it seems to me that it's an absolutely required feature of an intake clerk in a hospital to be able to listen to, learn, and spell the last names of the people they're taking in, particularly when they have documentation in front of them. Similarly, and we can all learn, it turns out. We can. Similarly, accents. I have the privilege of being in a lot of international settings these days. And, it's wonderful being in a room with the accents coming from Africa. And there's not just one accent in English from Africa. It turns out there's lots. It turns out that Ghanaians speak different than people from Kenya, and they speak different English in Nigeria, etc. And, of course, the Australians have completely unknowable accent, and the New Zealanders and all those different people from England. Like, the wonderful thing about English is it is accented, and we're not snotty about it like the French. So we just... I'm teasing. We don't have that vocabulary of how things are to be pronounced. So we need to see this as an asset. Learning to hear other accents is not that big a deal. It just means that you have to be willing and to practice that ear and to say, excuse me, can you say it again? So I put in my talk a series of skill sets, and I end with the final skill set, and that is what I call the rapport agenda. And that is that we have to learn to create rapport across differences. The guys have rapport with each other because they go to the same schools, they play in the sports teams, blah, 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 right? So rapport has to become a part of an agenda of organizations where we start to learn how to create rapport when people don't have those taken for granted backgrounds, and where we can learn to appreciate and like one another. Oh, thank you.
Okay, it's from somebody that's working with ICES, providing employment counseling to foreign healthcare professionals. The question is, how can we better use their skills and qualifications to serve the community and support themselves? Example, creating alternative careers. The problem is that they are overqualified. So can we have some comments on that from our panel? Is that...
In a research study that Catherine McKeegan, PhD student, and I have just finished, we had a woman, we had a focus group, and it was really fun. And one of the women in the group was a refugee from Afghanistan, and she'd been a nurse, and she's currently qualifying as a LPN, and she's working at one of the nursing homes in town at the same time, or one of the personal care homes in town at the same time. And one of the things she pointed out to me was that it wasn't every patient, but there were patients, and particularly patients' families, who didn't want her caring for their people because she was different. Right? And so Martine Dury and Kopp and I are trying to bludgeon Health Canada into letting us investigate this. Because I think that, first of all, there's lots of work for people with training, and there's lots of there should be lots of opportunity. But unfortunately, the way that we've organized the credentialing and professionalization processes in healthcare, it makes very, very few areas where people who have different kinds of expertise, to come in. So I think that health human resources is a really important area for now, I'm not recommending necessarily your committee take it up. I was going to tell a small joke that I now can do, which is, I've talked to quite a few groups of deputies, but when I was thinking about this, I thought about the last time I talked to them, which is actually, the last time I talked to the deputies in Nova Scotia, I said to them, you know something? You got to learn how to, work with difference, because you may think you're fine, but if you're a racist, your body language shows it, and everybody who knows how to read that body language knows you can't hide. I just realized I haven't been invited back. But in any case, my point is that these immigrant healthcare professionals, one is we should be finding ways for them to qualify, and secondly, if they no longer want to qualify, we should be finding work through the development of health human resources to have them employed properly in the healthcare system.